Now that you've had surgery, let's talk about all the things that you'll need to know for going home in your post-operative care. Everything that we cover will be provided in the handouts that we send home with you. Your surgeon has chosen a bandage that's appropriate for your incision. There's a few variations to that. You may simply have glue covering or sealing the top layers of your skin. The nice thing about that is there are no bandages required to cover that. That glue will stay in place and eventually slough off on its own. You may have a Mepilex or a silver impregnated bandage. That will stay on typically for 7 days. After 7 days, you will remove that bandage at home. Or you may have the fibrin mesh bandage that's glued to seal the top layer of your incision. That bandage will stay in place until your follow-up appointment where your surgeon will remove that at that time. The good news is that all of these are considered to be waterproof, meaning that you don't have to change a bandage, you don't have to wrap it to keep it dry in the shower. It's waterproof, so you can go ahead and start showering 2 to 3 days after your surgery. More detailed instructions specific to your wound care will be reviewed with you as well as in your written instructions. We will also review when you're allowed to shower and if or when you need to remove that bandage. Once you're allowed to shower, it's simply that, just a quick shower. Get in, get clean, get out. You're never going to fully submerge in water, so that means no soaking in the tub, hot tub, swimming, just a quick shower. Allowing water, soap, shampoo, whatever to run on that, pat it dry, leave it alone. You don't do any special cleansing of that incision, so you don't have to continue with that special cleansing like you did before surgery. It's just a quick shower. You don't put anything on that would especially keep it moist, like lotions, Neosporin, vitamin E. Just clean and dry is how we want your incision. Monitor that incision for any signs of infection. If it starts to look really red, hot, swollen, oozing anything from that incision or anything with a foul smell, or if you were to develop a fever, anything over 102, please contact your surgeon right away. Let them be informed of that. Avoid the urge to touch, pick, poke, or put anything on that incision. Also, keep your pets away from your incision. Right now, you probably don't have a whole lot of swelling or bruising, but just know that both are very typical in your post-operative recovery. And sometimes it takes a few days for that to then surface. So don't be alarmed if all of a sudden you have bruising all the way down your arm. If you've had your shoulder replaced, that bruising may migrate down into the front and the chest or also in the back, all the way down to the hands, the fingers. That's totally normal. For hips and knees, your whole leg is fair game for bruising. Sometimes you wake up and like, wow, that bruising wasn't there yesterday, or man, I had my hip replaced. Why do I have swelling and bruising all the way down in my foot or my ankle? Gravity. So don't be alarmed by that. Anticipate it. Know that it's coming. It is all normal. Some of the ways that we can help prevent or even minimize that bruising and swelling is with the use of ice. Don't underestimate the power of your ice. So now is when you want to start utilizing your ice packs, gel packs, frozen peas, cooling devices. I don't care what you use, as long as you have something cold to ice that joint. Ideally, you want to be icing that for about 20 minutes at a time. Take that off, give yourself about an hour break, and then do it again. Couple safety issues with ice. Like I said, keep it on there about 20 minutes at a time and then remove it. You're not doing any heat hot packs to that area. It's just ice. You also never want to put ice directly on your skin. Make sure that you have some kind of a cloth barrier, whether it's a shirt, your pants, or even just a pillowcase is a simple enough barrier, allows it to penetrate but protects that skin. Also, elevation, another great way that we can help minimize that swelling. Great way to elevate is to prop that leg up on pillows. Especially for knees, know that you guys are going to swell a lot and that's anticipated. So just prevent that as much as you can by elevating. elevating needs to be at least above the level of the heart, if not higher, which is why our recommendation, if you can tolerate it, get your toes above your nose. So get your head down, legs up, elevate that on at least a couple pillows, wedges, whatever you have to really get that leg up. Also, with the knee, know that as that leg heals, naturally, and it's going to be more comfortable, that leg is going to want to heal in a bent position. If you are constantly putting pillows, towels underneath that knee to encourage that bend, guess what? That's exactly how it's going to heal. So we do caution you, make sure that you're never putting anything directly underneath that knee that could encourage that bend. You want to make sure that that leg stays straight. So a good rule of thumb is to always have a full hand clearance directly underneath that knee. So move those pillows down so that you do elevate the calf, the ankle, the foot to really allow that leg to get up. Now eventually we'll pull those pillows down even further, but early on, yes, you can support the calf and the ankle to really achieve that higher elevation that we like to minimize that swelling. For shoulders, you're going to want to be more in an upright position. So if you can elevate the head of the bed a little bit higher, that will help with the swelling. Also having pillows, most likely you're going to be in a sling. So you will have pillows tucked behind you to support you underneath, to really immobilize that arm, to keep it in a neutral position. It also prevents you from doing a lot of movements, whether you're in a chair or bed, to really keep you in a safe position. Take home lots and lots of ice. Elevate as much as you can. Really will help to minimize both pain, swelling, and bruising. When we talk about your activity, that's probably the most important element in your recover is to keep you moving. Ideally, our goal is to get you up and moving every hour during the daytime. So every hour you're up and moving. This isn't a lot. Shorter, more frequent trips are better. So like a 5 to 10 minute trip up. Maybe it's a trip to the bathroom. You guys should be going to the bathroom a lot. So that counts, a trip to the bathroom. Next hour, maybe you go to the bathroom, you grab a glass of water, you come back and you rest. We want you up and moving frequently, but by doing too much, the longer distance will really fatigue you, but can also slow down your recovery. I know the temptation might be for some of you, well, if a little bit's good, then a whole lot's going to be better. Unfortunately, it does not work in this case. You cannot speed up your recovery. By doing too much early on will in fact slow down your recovery. This isn't a race, so get that out of your head. But if it were, be the tortoise, slow and steady. By getting you up and moving, it also works to decrease all of those complications that we've talked about. It helps stimulate bone growth. By putting more weight on that joint, it stimulates your bone to adhere to that new prosthetic. You're going to heal faster. It also helps with pain. As counterintuitive as it sounds, activity helps with pain, because motion is lotion. Your body, and especially that joint, is designed to move. And if it doesn't move, it gets stiff, it gets sore, and becomes painful. So by getting you up and move, motion is lotion. Keep moving. For those of you that have outpatient physical therapy, make sure that you understand when you need to go and where that will be. If you have any questions or concerns, contact us. We can help you in that process. Couple cautions with that. Number one, they're designed to help get you moving. And with that can have some pain or discomfort. So make sure that you medicate before you go. At least an hour before your therapy appointment, make sure you have some pain pills on board because they're going to get you moving, and that's their intent. Also know that they're going to fatigue you. By doing more exercises, it's quite normal for you to fatigue very easily. So plan to go to your therapy and come straight home and get some ice on there and rest it. Don't think, well, I'm already out. I'll run some errands. I'll go to the grocery store. No. Therapy, come straight home, get some ice, and rest that joint. Your therapist have reviewed all of your exercises with you. Hopefully you have good understanding of exactly how to do those exercises, but if at any point in time you have questions or you just don't remember, you can refer to your total joint notebook, the handouts that are included there, or you can contact the rehab department directly and they'll be more than happy to answer questions for you. Before surgery, we work together with you to help minimize your risk of forming blood clots by having you wear those SCDs, those compression leg squeezing devices. We had you do the ankle pumps, ankle rolls. We continue to have you do the ankle pumps, ankle rolls. So anytime you're hanging out in bed, chair, watching TV, that's a fantastic time to be doing that to really encourage that blood flow to get it pumping right back to the heart. We also have you up and moving every hour, short, more frequent trips, again, just to keep that circulation moving. Despite all of these things, some people do develop blood clots. It's very rare, especially if you're following all of these things to help minimize your risk. Well, how do you know if you have a blood clot? Typically, if you have a blood clot, it will develop in the calf or in the upper thigh. And you would know that because the calf would get suddenly red, hot, swollen, and painful. If you ever have any suspicion of that, what you'll want to do is put some ice on that area, elevate that leg at least up on 2 pillows, give it a couple hours. If that goes away or gets better, that's considered normal post-operative pain. A lot of you will experience stiff, sore, tightness in the calf, and that's where it gets a little bit difficult to differentiate normal versus not normal. So if you have done the icing and the elevation and that pain still hasn't gotten better or has gotten worse, you will definitely need to contact your surgeon. The clot in and of itself isn't a terrible thing. We can manage that. The problem is if you did have a clot, it could break free, traveling to the lung. That would become a life-threatening event, and that's why we take this so seriously. So that's, again, why we do all of these preventative measures. We also have you on a blood thinning medication to help minimize that risk. And some surgeons also have you wear those long compression socks or TED hose stockings. Typically, you will wear those for about 2 weeks. They're on pretty much all of the time. You can take them off up to about 2 hours a day. When you shower, let your legs air out and breathe, and then you put those right back on. So continue to follow all of these measures to really help minimize or decrease that risk for forming blood clots. Keep in mind that you're also on a blood thinning medication, which means that you are more prone to bruising and bleeding. So be mindful. If you are walking and maybe you bump into that coffee table or you hit the door frame of the door, you are going to bruise where you probably wouldn't. So be mindful of that. Be extra cautious, especially if you're shaving your face, to avoid any kind of nicks or cuts because you will bleed more than you normally will. Also look out for signs of too much bleeding. Looking at maybe a nosebleed that won't stop bleeding, you brush your teeth and your gums start to bleed, or if you had any blood or bleeding in the urine or the stool, please contact your surgeon right away. Here in the hospital, we have used many different avenues to help manage your pain. We want you to continue those same things when you go home. Thinking about doing your deep breathing. Ice, again, don't underestimate the power of ice. Everybody forgets to ice frequently, so keep icing. Elevate, keep moving. Like I said, by being active actually helps with your pain. Continue to use your Tylenol around the clock, and that will help give you a low base for continual pain management. If you can tolerate it and your surgeon has prescribed it, you can do anti-inflammatory medications as well. Follow the packaging instructions or the prescriptions from your surgeon. It is okay to take the Tylenol and the anti-inflammatories. Typically, you will alternate those. Occasionally, they will line up that you can take them at the same time, and that is safe to do. You will then use the narcotic pain medications when you start to have an increase or the breakthrough pain. That's when you will continue to use the narcotic pain medications to manage your pain. With all of these oral pain medications, you definitely need to make sure that you're keeping track of all of them. We have provided you with a pain medication tracking tool that you can write down all of the medications that you're taking, what you took, and when, because they all have different frequencies. It's really difficult to keep track of all of them. You're under the influence, so make sure that you keep track of that and write it down. It's also good if you can have a recovery station, so somewhere close by where you're going to be hanging out, to have the things that you're going to need, like your pain medication record, your pain medications, some water, and a box of crackers. All of that easily accessible, because in the middle of the night, 2 o'clock in the morning, when you need to take a pain pill, you also want to have a little bit of something in your stomach to help prevent any kind of nausea. It doesn't have to be a lot. Crackers, milk, yogurt, just a little something to coat the stomach. So get something in your stomach, take that pain pill, write it down, and that will help keep you managing your pain, but also keeping you safe. With the narcotic pain medications, make sure that you followed the prescription that your surgeon has given you, and any Tylenol or anti-inflammatories, follow their instructions or the packaging instructions. With your narcotic pain medications, it's very important that you never suddenly stop taking those. Your body can get used to taking those, and if you suddenly take those away, you can go through a withdrawal. Not because you're addicted, but your body just gets used to taking that. So over a course of several days, you'll just want to gradually extend the amount of time that you take those pain medications, a little bit longer each time, and then slowly start removing those. Continue to take your Tylenol and your anti-inflammatories if you're taking those. Those will also help to manage your pain and allow you to work out those narcotic pain medications. The other thing with the narcotics is make sure that you're keeping track of those. You never want to run out. So make sure that you keep track of those. Notify your surgeon for a refill. Typically, all of the surgeon's office will require at least a 2-day, 48-hour notice for any refill on your prescription. So they won't fill the same day and they won't fill on the weekend, so make sure that you're keeping track of those so that you don't run out. One of the other big side effects with the narcotic pain medications, constipation. Here we are again, as promised. I told you we're going to talk about it. Ways that you can help to really minimize that is to do lots and lots of fluids, so hydration. By getting you up and moving and walking, that also stimulates that gut to keep moving. And then you're also doing your over-the-counter stool softener laxative combination pills twice a day. We have given you that prevention and management of constipation tip sheet. Go ahead and refer to that, because our goal is to get you to have a good bowel movement at least every 3 days. Hopefully it's more than that. Just don't go more than 3 days, because I promise it's like a blast of dynamite to get you going again, and you don't want to have to deal with that. So make sure that you're staying proactive. Be very aggressive to make sure that you keep those bowels moving. You have a pain pump catheter that's been placed by your anesthesia doctor to help manage your pain. The pain pump is not intended to be a single answer to pain management, but rather it's to be used in conjunction with the oral medications that hopefully we have started using here in the hospital. After surgery, you will be able to manage that pain pump. What that means is that you will be able to adjust that pain pump according to your pain levels. So when the anesthesia starts to wear off and you start to experience more pain, if you haven't already, you will need to start taking those oral narcotic pain medications. If you haven't, that's when you want to start taking them. You also, at that point in time, will increase that pain pump all the way up to the highest level. Usually that's 14, so go ahead and turn it all the way up. The reasoning behind that is the pain pumps run at such a slow rate, it's going to take a really long time for you to notice any effects of that. So go ahead and adjust that all the way up to the highest level. Let that run for about an hour. That will allow the pain pills to kick into your system, as well as that pain pump, the local anesthetic, to get into your system to hopefully start bringing that pain level down. At that point in time, you can go ahead and adjust that pain pump and bring that level back down to a comfort level. You can go ahead and leave it up at the highest, the 14 level, but what that means is that you're just going to run out of that medication a lot faster. Typically, these pain pumps last anywhere from 2 to 4 days after your surgery, depending on that rate. Once you get to the point where you have run out of that medication, you will know that because that ball or bulb is filled with that local anesthetic. When it's full, you can feel it, you can hear it, it shakes. As that starts to utilize that fluid, that ball will start to collapse on itself. It will shrink, the volume will become less, it's lighter, eventually it will run out. Like I said, typically that lasts about 4 days. Sometimes the anesthesiologist will have you go ahead and remove that after 4 days, even if there is still some residual medication, because that can put you at a higher risk if that catheter is left in too long. Usually the anesthesiologist that places that catheter will continue to follow you at home. They will call you and just check in to make sure that your pain is being well managed and answer any questions that you might have. You will be provided their contact information that you can reach out to them if you have any questions. So let's talk about the removal process of that pain pump catheter. The catheter, the tubing, has been inserted underneath the skin close to the incision site of your shoulder. That's typically only in the skin about 1 inch to 1.5 inches, so it's not very far. That has been taped down very securely. When you go to remove it, you will just simply need to remove all of that tape. And by you, I probably mean someone else helping you out. So they will remove all of that tape. What you may find is that sometimes just simply removing all of that tape, you may inadvertently pull out that catheter. Like I said, it's not in there very far, and sometimes just the pulling off the tape, the catheter comes out, and that's fantastic. If you get to the point where you've taken off all of that tape, all you'll need to do is just gently pull that catheter out from underneath the skin. It should not be difficult. You shouldn't ever have to really pull or yank on that catheter. If you do meet resistance or have difficulties removing that catheter, stop, call the 1-800 hotline number that we have included in your handouts. They will walk you through the remainder of the removal process. You want to be very careful as you remove that catheter. Once it fully is removed, you need to make sure that you see a solid dark tip at the end of that catheter. What that means is that the entire catheter has been removed and no remaining pieces of the catheter are left in the skin. If you pull that catheter out and there is no dark tip, you need to contact that 1-800 hotline number once again, and they will instruct you of what to do. After the catheter has been removed, simply put just a little bit of pressure on that area and then cover it with a Band-Aid, and that's it. All of the material, the tubing, the pain ball, or if there's any medication in there, like I said, it's just a local anesthetic. You do not have to do any special disposal of that. All of that can just be discarded in regular trash. Sometimes that catheter can dislodge. Like I said, it's only in there about 1 inch. So sometimes inadvertently, just by moving around in bed, is just enough to dislodge that catheter and it may start to leak. If that happens and you're finding that the back of your neck or maybe around the shoulder is starting to feel a little bit wet, but you're still feeling like you're getting good or adequate pain management, go ahead and just cover that area with some gauze or a towel and leave it alone. Allow it to continue to infuse because it still is helping to manage your pain. However, if you're finding that it's leaking, it's wet, but you're really not getting good pain management, then all it's doing is getting your neck wet, and then you would just need to remove that. Follow the same protocol. Make sure that you see that solid dark tip. Put a little bit of pressure on that area, cover it up with a Band-Aid. When should you call? First of all, for any kind of pain that either is sudden, increased, or uncontrolled, if you're having any new weakness to that area or joint, contact your surgeon. If you have any issues, concerns, or questions about a probable infection, like we talked about, redness, hot, swelling, oozing, pus, green stuff, foul smell, or a fever over 102, contact your surgeon. If you have any calf pain, tenderness that is not relieved by ice elevation on at least 2 pillows, please contact your surgeon. But above all, you are going to be the best judge. If something just doesn't seem right, don't hesitate, call. If you ever have sudden, severe chest pain, shortness of breath, or any stroke-like symptoms, so if you can remember the acronym FAST, facial drooping, arm weakness, especially on one side, slurring of the speech, know that time is of the utmost importance. You need to access help right away. So those are 911 get help right away phone calls. As you go home, know that your healing is a process. Be patient with yourself. It takes time to recover. And remember, you can't rush this, you can't speed it up any. So be patient and allow yourself to go through the proper timing. The first week in your recovery can be kind of rough, and there's going to be some up and down days, and that's normal. Know that they're coming, it's anticipated, expect it. You may have had one of those, oh my goodness, what was I thinking? Why did I even have this surgery? I hate my surgeon. That's normal too. So just know that all of this is part of that healing process. Usually, kind of the days 2 through 5 are the worst, and then things get better. You have a big turnaround. Another landmark is the 2-week mark. Usually by then you're feeling better, you're having less pain, you're not taking those narcotics, so you're feeling more like yourself. By 6 weeks is kind of that magical, oh, I feel fantastic. Why did I wait so long to have my joint? I wish I would have done this years ago. I wish I could tell you it's going to be easy. It's not. That's what we're here for. If you need those words of encouragement, if you need someone to answer those, is it normal? Am I supposed to be going through this? Call us. That's what we're here for. We'll be your biggest cheerleader. We have provided you with a lot of information to help you be successful in your recovery at home. It's been a pleasure caring for you. We wish you all the best for a very successful and uneventful recovery.